let's dive straight into the pulse of the healthcare diagnostics market.
Cheers.
And try these cocktails. Yum.
Really good.
Yeah, it's probably the best one we've made so far.
Yeah, I mean, it's been a low standard. Yeah. I love we had the same thought.
Oh my God. Okay, let's talk about investing. How would an everyday investor even begin to analyse these kind of companies?
Yes, so I would think of diagnostics as sitting between science and workflow. There's kind of a few key questions to ask. The first is the care pathway. Where does the product sit in the patient journey? Does it replace an old test or does it triage, who needs an expensive one? The thing is, if you can't map that pathway, then it can be really hard to value the company.
Right, so it's very important that you understand where it plugs into the system.
Yeah, exactly right. And then step 2 is the evidence. So you need to understand how accurate it is. And then evidence is also about whether it leads to actual outcomes. Are you seeing fewer unnecessary procedures, faster diagnoses, or a shorter length of stay? Those kind of better outcomes. Then in terms of actual evidence, there's different levels of evidence, if you will. So randomized controlled trials, they're the best kind.
So I guess if it's just an expensive trial, it could be a red flag, but it has to actually change what a doctor does.
That's exactly right. And then the next step is regulation. So in the US, the FDA pathway matters because it dictates speed to market and also what the company is allowed to say.
How important is it to follow the money when investing in these kind of companies?
Yeah, I think it's very important because, if you do really need something, even if it's $100,000, are you going to pay for it? Probably not.